Okay, hello there, folks, in my Intro to Psychology courses. I'm going to use this portion for when I'm gone this September 19th and 20th, so you can still get the lecture via this. History of drug use in humans. We've probably used drugs since we've been humans. In fact, we're not the only species who use drugs. As you know, birds will prefer fermented fruit, cats like catnip, etc. So, we're not really the only one to even use drugs. We now have substance use disorders, as opposed to substance dependency and substance abuse. The DSM-5, what we use now for our diagnostic criteria, they're all called substance use disorders. That's because most everybody had both both abuse and dependency issues. So don't even need to worry about those now, given that you have the DSM-5. Yay to go on. Lots of different causes. Insula, your textbook talks about that. Reward pathways, dopamine in particular, of course. And genetics Genetics are a risk factor for pretty much everything and a benefit for everything as well. And lots of psychological factors, including where we live, our society, our friends, people we associate with. If everybody around us is doing drugs, chances are we will as well. Lots of different types of treatments for addictions. Alcoholics Anonymous, Narcotics Anonymous, or for example, are very commonly used with their 12-step programs. Medications for various ones. There's opiate replacement therapy, nicotine replacement therapy, anti-abuse for alcohol, and various other ones that can be used to treat these addictions. And of course, psychotherapy, motivational therapy, cognitive behavioral therapy, etc. Treatments can work. These are fairly difficult ailments to treat. It takes a lot of motivation on the part of the person who's ill to respond to treatment and to get treatment. And really, it is their motivation that is one of the main factors in prognosis. DARE, Drug Awareness Resistance Education. Many of you probably had DARE, graduated from DARE. The thing of it is it doesn't work. Why do we still use it? Nobody knows, but we do know as a program it does not work. So here's the insula. It's kind of deep in the brain, has a lot of reward pathways in there. So I'm going to go, my lecture is a little bit different than what the textbook has, which is why I have it separate. I think there's three general types of drugs: the depressants, stimulants, and psychedelics. I'm not the only one to think that. Most people do. And it's just kind of a nice way of categorizing them: depressants, stimulants, and psychedelics. Here we are. This is from an older textbook, but I still like them. I think how marijuana has mixed effects, but I put it under hallucinogens. Opioids I have under depressants. So these two I clump together. So here's opioids. We have opioid receptors. That's obviously opium is the base. This is in Afghanistan. Most all of the world's opium is grown in Afghanistan, which is really interesting. But that's where we get it. We still have the war going on over there. A lot of it is financed by the opiate and heroin trade. Ain't that interesting? Oxycodone, that's the type that's actually a name brand. It's Oxycontin, or oxycodone is in OxyContin, excuse me. This one is one of the main reasons we're having the opioid epidemic right now. Lots of people are dying from this stuff. Fentanyl, which is a really strong opiate, way stronger than heroin even, is being placed in heroin when people are shooting an IV, and that's what's causing people to die. Something to the effect of 70,000 people are dying from opiate overdose a year now. It's really a crisis. It's an incredible crisis. You can get Narcan. Narcan, and people can learn how to give Narcan. If someone is overdosed on an opiate, you can use Narcan, and that will stop the overdose. It will save their lives. It won't treat their overall addiction, but it will keep them alive, which is good. Benzos, we'll talk about these more so when we get to the psychiatric disorders. Just briefly, they act on the GABA, gamma amino benzoic acid receptor, and there's lots of them: Valium, Xanax, Ativan, etc. There's many more. They're used for mental health issues, anxiety, and sleep. Generally aren't abused if people know how to use them, but some people, of course, can get quite dependent on them. And alcohol. It's funny, we talk about the problems we have with the opioid epidemic. A lot more people die of alcohol every year. It's just we're used to it. So, auto accidents. Is it have any beneficial effects? Yeah, some studies, maybe with red wine. Kind of hard to say because people who drink red wine are weird. They're generally healthier. They don't smoke. They're better educated. They exercise. So is it the wine or is it everything else? We don't really know. Um, so mechanism of action is also on the GABA receptors. It increases the GABA receptors and also impairs the glutamate receptors. So it increases the inhibitors and decreases the excitatory neurons. So increase the things that stop you and decrease the things that start you and get you drunk. Detrimental effects, yes, there's a few: liver failure, car accidents, murder, suicide, overdose, seizures, stomach cancer, pancreatitis, and you can get a permanent dementia, Korsakoff psychosis. So too much alcohol, probably a real bad thing. Alcohol withdrawal syndrome, if they shake, it's essentially a really bad hangover. You feel nauseated, you want to throw up, you have a hard time stopping shaking, and sometimes you can even have a seizure. You can have withdrawal seizures and hallucinations, so-called DTs, delirium tremors. You'll have hallucinations withdrawing from alcohol. So moderation, people enjoy it, but obviously alcohol can be quite the problem. Stimulants, cocaine, dopamine, and norepinephrine mainly. People get very wired, feel very euphoric, and will feel like they really want to accomplish lots of things. Not really used therapeutically, although it is made into lidocaine. Lidocaine is a local anesthetic. You may have heard of lidocaine. It's a cane. Instead of it's lidocaine. So it is related to cocaine, and that is just used to block sodium channels. As a matter of fact, sodium channels on the neurons around your teeth and skin when they try to give you an IV or something like that. So lidocaine. Social issues in history. It was first used in the Andes Mountains in South America, in some of the jungles, from the natives there. Turned into really expensive cocaine and brought up to the States. It then mutated into rocket cocaine and went from the rich people to the inner cities. Now it's reached sort of a baseline, and it's not nearly, at least from my understanding, it's not as much of a problem as amphetamines, methamphetamines. Stimulants are used for attention deficit hyperactivity disorder. Adderall is an amphetamine. It's a mixed salt amphetamine, but it is not methamphetamine. Methamphetamine is quite the problem. It's a scourge of our community, scourge of our nation. It's right up there with opiates. In fact, a lot of people will use both. It's really quite something. Dopamine as well. As you know, people get quite agitated on it. They obviously will have a euphoric effect. That's why people use it. But they also can get extremely agitated in the high doses because of the dopamine activity. People can get psychotic. They have hallucinations, delusions, twitches. They also, that causes a little necrosis. The blood goes away from their skin. That's why people on meth sometimes will have a lot of black on their skin. As you can see over this guy and this gal, that you can see their skin. That's from excessive methamphetamine, obviously, use. Lose weight, get psychotic, their teeth fall out, and that's really bad. It's really bad for dentition. And what's been noticed lately is that people who have schizophrenia and use methamphetamine really worsen their prognosis. Really worsen their prognosis. So it's a really horrible drug. Apparently extremely addicting, given that it's being used so often in so many places. So hopefully we'll be able to get on top of this. I don't know if we will. Frankly, it gets a little bit discouraging. MDMA, ecstasy, also is dopamine and serotonergic, so it's kind of mixed. A lot of stuff is coming with MDMA and post-traumatic stress disorders. Really interesting. PTSD and MDMA treatment. That acts on the glutamate receptors and dopamine and serotonin, as we say up here. So we'll see. Sometimes these psychedelics, they might be turning into something that's worthwhile. And MDA is not just a stimulant, it's also somewhat of a psychedelic. It increases empathy, for one thing. People on NMDA will have more empathy toward others and toward their own emotional states. And that's the idea for treatment of PTSD. Caffeine's a stimulant. It blocks adenosine, for what it's worth, and that by blocking adenosine, it increases dopamine. Lots of people use caffeine. I suspect most of you did today, or at least a good chunk of you. It wakes you up, lets you focus more, gives you attention, and you stop it, you'll feel really horrible. You'll have a headache, you'll be dysphoric, that means really sad, you'll be irritable, you'll sleep all the time, and it's not really very fun. Excuse me, from the current data, it doesn't look like caffeine dependency, which if you drink a lot, you have it, is a problem. It seems like at moderate doses of 3 or 4 cups a day, and people do okay. That said, a lot of people drink those energy drinks, which have like way high caffeine levels, and that can be quite detrimental, like when they can't sleep and just get trembly, etc. Nicotine. Use in psychiatric patients, in particular folks with antisocial personality disorder and schizophrenia. Not both of them, but either of those disorders, a lot of them smoke. Something to the effect of 95% of people with schizophrenia smoke, something along that. It acts on nicotinic, go figure, nicotinic cholinergic, that's like acetylcholine, right? It's one of the neurotransmitters we've been talked about. So nicotine, acetylcholine. And great drug, it calms you down while it wakes you up, except for, yeah, it's the worst thing yet. Still the cause of most public health issues, heart attacks, lung cancer, strokes, other kinds of cancer, stomach cancer, what other kind of cancers? There's all kinds of cancers come from it. Oral cancer, chronic obstructive lung disease, COPD, a horrible, chronic obstructive pulmonary disease, excuse me, it's P, not L. A horrible way to die. You slowly but surely suffocate. So, it makes you stink, bad for your dentition. Most people who smoke started smoking in their teens, if not early teens. Now, that's because when you're a teenager, as we'll learn later in the semester, you do things that aren't so smart. It's called personal fable, and it gets in the way of many a teenager. So if you smoke, stop. It's not hard. It's not easy to do, but you can. Most people go cold turkey, and you just have to be motivated enough to get through the withdrawal, which you'll feel like crap. You'll really want a cigarette. You'll feel shaky. You'll hurt and irritable. Again, give yourself about 2 months. That'll go away. People will every now and again crave a cigarette, even years after they've stopped smoking. That's because it's just so ridiculously addicting. But stay off it, and you can do it. So I want to give you a couple of TED Talks on the psychedelics as well. They act on serotonin as a partial agonist. A lot of stuff is happening on them. And again, I'm going to just link you some TED Talks for this instead of going on. It's a little bit easier for the Moodle actually is to have those links. Lucy in the Sky with Diamonds. Things will get bigger. Things will have more brightness. Things will move when they don't actually move, etc. They're called psychedelics as opposed to hallucinogens because you don't really hallucinate. I mean, people do, of course, but oftentimes they'll hallucinate and know it's a hallucination. Therefore, it's a pseudo hallucination. Probably not too many therapeutic effects on LSD, though those two are being looked at. Peyote, it's a cactus used in a Native American church. People who use it within the church tend to do better, tend to be less violent, tend to not do other drugs. It's very much ritualistic. This is not just something natives use. They have huge rituals around it, very much ceremony, their own songs, their own priests, etc. It's a very, very structured religion. This is a very strange one. Luckily, it's illegal now. K-opioid receptors, Salvia divinorum. People smoke it, or I guess sometimes they just chew it. Stupid powerful hallucinogen, but only lasts about 10 minutes, I guess. It's now illegal. It was legal for a while, but now it's illegal. Only lasts about 5 to 10 minutes. It doesn't sound fun. I've had students talk about it because it was really popular. You can order it on the internet and get it at the man store or something like that. It was really popular for a while, but it doesn't sound fun. It sounds like people who use it just kind of get like Frodo slipping on the Ring of Power. And they'll kind of roll on the floor, salivating, and then kind of you'll feel people poking at them. And yeah, not too many people use this more than once or twice. Psilocybin, again, this is going to be a TED talk on this, linking these kind of psychedelics. They're really coming out to have more therapeutic usage. Again, it's a psychedelic, so it acts on the serotonin receptors. But the psilocybin mushrooms are panning out to be somewhat useful, interestingly enough. They can be abused, of course, as can any of these drugs. So people are microdosing them, from what I understand. Just taking a bit of psilocybin through the day. I can't sort of picture that, but apparently this happens. Ayahuasca. These are two species of plants combined. Dimethyltryptophan. Two species of plant from the Amazon. I mean, think about that. How many plants are there in the Amazon? A lot. How did these folks come up with the two that are necessary to allow DMT to be processed and give you the hallucinogenic and psychedelic properties of ayahuasca? It's really interesting to me. Of course, they would say that they are given these by the spirits. They were directed there by ayahuasca spirits. Shaman activity, a lot of religious activity, again, goes around the use of ayahuasca with the natives in the Amazon. And here's some pictures of it. This is what people draw while on it, or I'd rather draw while off of it, but this is the kind of visions they see on this stuff. I mean, how wild is that? I mean, you only got these spirits and these UFOs up here and all these sort of things. And here's the people down here who are the vegetistas, the one using it. So it's quite the thing. It's just, yeah, it's quite the thing. I can see why people will feel that there are other worlds. And who knows, maybe they are. I don't know. Cannabis, it's now becoming legal. Medical cannabis here in Montana. See the little stores everywhere with their little clever names, the higher brand, etc. It's cannabinoid system. This is the main neurotransmitter system, and it's becoming legal in more and more states. It's, I think, probably within not too many years it will be legal nationally. Other countries have legalized it: Canada, Portugal. Even here, Mexico's thinking of legalizing it, which would be interesting for the cartel. But widely used, not benign. It is not benign. That's something to keep in mind. Turns out that people who smoke a lot of pot as an adolescent have an increased risk of developing schizophrenia. So it is not an absolute safe. It's not a herb that you put on your pizza. No, it actually has some significant troubles to it. So if someone says it's benign, it doesn't cause any trouble, they are wrong. That said, should it be legalized? Well, I think all drugs except maybe the methamphetamine should be legalized, because I think it will decrease problems. It will decrease the legal issues and turn them into the medical issues that they actually are. And entheogens, this is some separate realities. Entheo means God within. Getting to God within. Can you use hallucinogens and psychedelic and spiritual quests? Yes, maybe. Are there separate realities? And some of these, how can simple molecules change subjectivity? That's really interesting. And what does that say, therefore, about the nature of consciousness? Dun dun dun. Check this out. It's an organization that works toward legalization and research into the psychedelics. So, multidisciplinary Advocates for Psychedelic Studies. I think that stands for MAPS. Check it out if you're interested. All right. Well, thank you. In a talk.